Hello everyone, welcome back to my channel. This is Dr. Kamsha, and in today's video I'm going to talk to you guys about the dying back phenomena, which is super commonly seen in neuronal injuries. So let's quickly first understand and review the structure of a neuron. So these are the dendrites. This is the cell body or soma. This is the axon. This is the axon terminal. These are the nodes of Ranvier, which help you with the super fast conduction of impulses. Now suppose there's a nerve injury here. The entire part is, so this is going to be distal to the injury and this is going to be proximal to the injury. The part that's distal to the injury, the first step that happens is going to be an axonal termination is going to cut off. The axonal terminal fails. So this is the part that's going to probably disconnect from this. The second part that happens is there's demyelination of the part. So imagine there's a cut that has happened here to the nerve and the entire part that's distal to the injury or the lesion is demyelinated and cut, and this has been cut off. The third part that happens is the proximal part is going to die back. It's going to die towards the soma or the nerve or the nucleus. And this entire procedure, it takes about 7 weeks. So it takes about 7 weeks to die and 7 weeks to grow back, which is approximately 4 months. So the prognosis in such patients is definitely not great. Another important thing that you need to consider is there could be different types of injuries. So the prognosis also depends on the type of injury. It could be an axonal damage, or it could be just like demyelination. So in case of demyelination, the prognosis is going to be better as opposed to axonal damage. So basically, the entire framework of the prognosis is about 4 months. But again, depending on the injury, the type of injury, the prognosis may differ. Also, another important procedure that happens is after the entire axon has died back to the nucleus, there is axonal sprouting by the neighboring axons. What does it mean exactly? So after this particular axon has been died, before even it starts growing, the neighboring axons, they start sprouting, which is also called as collateral sprout. So they start sprouting and they try to take over the place of this particular axon. So there's kind of a competition between the two, and that's called synaptic stripping. And I hope this particular topic has helped you to understand what is the time frame and how long does it take exactly for a neuron to die and grow back. It's not an easy procedure. It takes a lot of time, and the clinical implication of this particular procedure would be you decide your diagnosis, your prognosis, and also you have to plan your treatment plan accordingly, depending on how the prognosis is going to be like. Thank you so much for watching.